Okay, welcome. We're going to do another podcast today, and today we're going to talk about pediatrics. This is something that I haven't been trying to put off talking about this. Actually a really important topic to me, and the reason that I've waited so long to do this is because it is so important to me that I want to make sure that I do it right. And so really, in a situation like this, I don't know if I'm going to cover everything I want to cover in talking about pediatrics. With chiropractic, but something's better than nothing. And so what we're going to do is I'm just going to go ahead and get started. Now, my pediatric chiropractic journey really started back in chiropractic school. I went to school in Portland, of course, and I remember there were a couple of times where we had some people come in and start to train us on the idea of adjusting kids. Now, it's something, and I don't understand exactly why, but even back then, there were some students that were resistant to the idea that kids need chiropractic care. I remember one student in particular, a fellow student of mine, who's just adamant that there's no way a kid could need a chiropractor. And I never really understood that. There's such a disconnect there. Most of the time I can kind of see somebody's perspective and point of view on things like that. I really work hard to do stuff like that, to see things from other angles. But in this situation, it was really baffling to me. I still just don't understand why he would say that there's no way that a kid could need a chiropractor, not even worth a check. And so even back then, it kind of started for me. But we had people come into the classroom a couple of times and say, okay, this is how you adjust kids, and there were some after class I guess classes, but just kind of not part of the normal curriculum, where people would come in and teach us how to adjust babies and kids. And it was really interesting to me even back then. So, of course, coming from a big family and coming from this community where family is so important, and there's so many kids here in Utah Valley, I don't know if that's really what spurred my interest, or if there was something else or something more. But that's kind of where I started. I still actually lean on things that I learned back in school. This is like 18, 19 years ago. And so that began my chiropractic journey in pediatrics. It wasn't until, so after I graduated from school, we had, I had some troubles learning how to run a business and learning how to attract patients, and, a lot of different stuff. And so pediatrics was like far from the center of my mind for a lot of years. And so it was later on, I'd probably been in practice, I think I had started Tempe Chiropractic, so it was probably six or 7 years at least, 6 or 8 years, I guess, before it really started hitting me again. And I remember I went to a chiropractic conference at the Utah Chiropractic Physicians Association, the UCPA. They do 2 a year. And one of the speakers at this particular event was Christina Stitcher. Now, she actually has an office up in Salt Lake City, and she's amazing. And she's been through a lot in the last couple of years, but she's well known in the chiropractic industry as someone who's very knowledgeable on pediatrics and pregnancy especially. And she's just a powerhouse chiropractor, and I really respect her. And she actually gave something of a Webster technique training. Now, Webster technique, if you go back and watch my pregnancy episode of the podcast, Webster is a certain technique that basically it's an evaluation and adjustive technique for pregnant women. And so she gave a little bit of that technique away there, which was really super helpful for me. I didn't get certified in Webster until several years later, but I learned a lot there. But one thing she said was really important to me. She said, if you are not adjusting kids and families, you are robbing them of the opportunity to be healthy, and you're robbing your practice of their presence in your office, because adjusting kids changes everything. Adjusting kids really it brings a whole different life to your office, and you're not expressing yourself well as a chiropractor if you're not adjusting kids. And for some reason that really resonated with me. It really hit home. I'm kind of, going into school, I was much more like I wanted to treat athletes, and I wanted to get into sports medicine and, sports chiropractic, functional medicine, and as far as that stuff goes, that's what I thought I'd be much more interested in once I graduated from school. while I was going into school. And coming out, it's been really interesting because I've heard that same notion a few times where if you're not adjusting kids, you're robbing them of their future health. And your practice is going to be less because of it. And not just necessarily the financial aspect. I wouldn't say that kids are a huge financial, portion of my practice. I actually see more pregnant women than I do kids, and I see, just general population much more than I see either pregnancy or pediatrics. And so having kids in your office really it invigorates the office, and it's really a cool thing. And to see such great changes happen so quickly is really remarkable. And so it really does make my life better. It makes my office better to have kids in it. And of course, we're changing kids' lives. And so it's hard to know kind of where to go next with this topic. There are three cases that come to mind when I'm talking about kids. Now, the first case is really interesting, and I love this case. There's this gal that I was seeing for a while, and a couple months actually. She was coming in very consistently, and when we talk about our little girl, and she was always just a little bit hesitant to let me adjust her. And I get it. I understand that this is your baby, and you don't understand. If I'm adjusting the baby or a little kid like I'm adjusting an adult, that can be pretty intimidating, and I totally understand that. But that's not really where we go with it most of the time. It's usually much more gentle technique. And so I believe this little girl was 3 years old, so not exactly a baby, but you know what I mean. And so this little girl was about 3 years old, and the mom. She ended up moving, and she was going to move the next day. This is literally the next day. And I said, just let me adjust her. Just let me check this baby girl. And so the problem was she slept really well for the first year, and the second year, maybe she was only 2, but for the second year, these are the details that I remember, I guess. The second year, she hadn't slept really well at all. So she slept really well for a long time, and then she just stopped sleeping a while. And so I was like, just let me check and see what's going on. So we put her. She had a couple of visits that she'd prepaid, and so she's like, I might as well use one of these. And so I put this little girl on the table, and the technique that you use for little ones is really simple. You just take your little fingertips, and I put right under the ears, right behind the jawbone, and that's where you can feel the lateral masses of C1 or atlas, which is the top vertebra. And so I did that. I just had her lie down on her back on my table, and I just put my little fingertips right there. And I was just holding and just kind of sensing what was going on. And I was talking to Mom and, just making conversation or whatever. And suddenly, this little girl, you just watch her body, she just shuddered. Her whole body, a shudder went through top to bottom. And then she started snoring. And it was the most remarkable thing. That's why this story stands out to me so well. It was really remarkable because she saw it and I saw it, and I felt when I had my fingertips there, it's a really, really light sensation. I just felt that bone shift over, and it wasn't like it shifted over and then suddenly she fell asleep. But she was very comfortable, and I felt it gently slide into place, and I wasn't pushing. You're just touching here, and just really, really gently. And this little girl just fell asleep on the table right in front of us. And it was the most remarkable and, yes, kind of the most beautiful thing. And so I actually did talk to her the next day. I followed up with her. And she said it was amazing because she went home, and I don't remember exactly the hours, but she slept for like 4 hours when she got home that night. And I was thinking, oh my gosh, she's not going to sleep all night now because she got this huge nap in before bedtime. She said she was up for 2 hours, and then she slept until 8 o'clock the next morning. So this little girl got several nights worth of rest in just one day. Her body was so tired, and it needed the rest so badly. And just a really simple adjustment. She didn't cry. She actually fell asleep during the adjustment. That's how gentle it was. And it really stood out to me as an example of this is why kids need to be adjusted. This is why kids need chiropractic care. There are a couple other examples. Hopefully I remember to get to both of them. But there's a study that came out in 2015 in the Journal of the American Osteopath Association. Now, I have to give osteopaths credit. They are very medically minded for the most part, and they're basically equal to an MD. So they're very allopathic in the way that they approach things, and so you don't think of it chiropractors. I talked about this in a previous episode, but kind of at odds most of the time, just because of a philosophical view of the way the body operates. Chiropractors believe that everything comes from the inside out, and for the most part, allopathy believes that everything needs to come from the outside in to take care of the body, for it to be able to heal and function properly. And so it's really cool to see studies like this, because they really do. A lot of osteopaths are in the same boat as chiropractors. We just want to make sure the body's functioning well and coming from the inside out. And so they did a study. And they looked at 100 babies it was between 6 hours and 72 hours after birth. And these are just considered normal births. And so this can actually be considered C-sections, forceps deliveries. There were lots, but these are just considered normal births. And so nothing terribly out of the ordinary, I guess, in other words. So they looked at basically every segment or section of the spine, starting at the base of the skull, down C1, C2, lower neck, upper back, lower back, and pelvis. And what they found was it was a remarkable amount of injuries that happened in these babies. And so, for instance, the base of the skull, and I believe I'm getting these numbers right. I talk about them all the time, so hopefully I'm just getting them right. But the base of the skull, they said about 95% of babies had injuries right at the base of the skull. 91% also had injuries lower in the neck. And so most of these babies actually had more than one injury in their neck between the base of the skull and the top of the thoracic spine, or the top of the upper back. It was a lower number. I can't even remember the number for the upper back, because that's less relevant for most situations that I'm talking about. But it was like 95% again in the lower back for these injuries. And so they identified injury processes throughout the spine on almost all of these newborns. Basically, all of them had injuries. And that actually correlates with my experience as well, where I'll check a baby. There are only 2 babies that I can think of that I went through and checked and adjusted. Only 2 babies that out of all of them that I've ever checked and adjusted that didn't need anything adjusted on them. And so babies just come out stressed for the most part. And there are reasons for that. And maybe I will delve more into that neurological kind of stuff going on as far as stress during pregnancy. There are a lot of different factors that also go along with that. And so a lot of injuries occurring, and so that's why we need to adjust these babies, these little kids that come in. Now, I want to talk about the reasons that most people bring their babies in to see me. More often than not, it's going to be colic. Colic is huge because it's really miserable both for the baby and for the parents. And it's interesting to see the difference between a parent who brings a baby in for colic versus a parent who just brings their baby in for a well check. And that does happen. It's not super common, but it does happen. And this baby, let's say this baby comes in with colic, and they are just screaming and screaming, from the moment they come in until we get them adjusted. And sometimes they're even crying through on the first couple adjustments until the time that they leave. And parents are just like, yeah, it's just the way it is. And you contrast that with somebody who brings their baby in who doesn't cry all the time, and it's a much different experience to watch that parent if the baby starts crying. They're trying to soothe and give the binky and put their hands on them and that kind of stuff. What happens with a colicky baby is, yes, there are absolutely more often than I'm guessing all the time that I've ever adjusted a baby that's got colic. I know in my experience it has been. Every time I've adjusted a baby with colic, there have been injuries in the spine. And to have that happen and have that crying all the time for a parent is just, it really creates a disconnect. And it's a terrible thing to experience and see for these parents. They want to be more connected with their baby, but they're like, there's just nothing that I can do about this. This baby's just crying all the time, crying at night, crying during the day, crying during nap time. The only time this baby's not crying is when I'm holding him or her on my chest, all day long. And even swaddles don't work after a while. They have to actually be holding them with their arms. And how babies, sometimes they have altitude control or altitude awareness, where if you're sitting down, they'll be crying. They know if you're standing. My babies went through periods like that. And so it's crazy to see this disconnect that occurs. And it's not a true disconnect, but it is to a point, I believe, where the parents just like, I have to just switch it off. I can't be concerned because the baby's just crying all the time. What else am I supposed to do? And so it's really important when a parent brings their baby in that we're able to get some resolution of this. Now there are some instances, and this comes to mind immediately, where no amount of adjusting has helped. Well, I shouldn't say no amount, because there's just a finite number of adjustments that people in their mind are going to give me, and usually it's like 3 or 4, and it's like, this isn't helping, and then they go try something else, or they go, they give up, which is unfortunate, but it does happen. But to be able to hold a baby in my arms and go through and check the spine and adjust certain things, whatever needs adjusting in the spine, and hand that baby back, and then say, okay, we're going to see what happens. And then the next day to find out this is the first time they ever slept through the night. And my husband noticed. See, that's the most important thing for me. My husband noticed that there was a huge difference. And so we both were able to sleep better last night. Because moms notice everything. And moms are the ones typically who bring the babies in because they're the primary caretakers, and they are the ones who are, dealing with the issue most of the time. Now, that's not to take away from dads. I have had some amazing dads bring their babies in, and they're the ones who are coping with this as well. And so props to them certainly for doing that and to bringing them in. But colic is huge. It's hugely important to find out what's causing that, because the thing that I talk about all the time with parents is it's obvious the baby's in pain. They just can't say, I hurt, and so they're crying. That's their only means of communication that way. And so to have a baby come in and be able to make a huge difference, of course, man, that's a tremendous blessing in my life. And I love every baby that comes in here. I love being able to serve in whatever capacity that I can. Now, there are other situations as well. There are babies that come in with reflux. That's been really, really big lately. I've had a lot of babies come in with reflux. A lot of parents are being told, yeah, you got to put your baby on this or that, or avoid milk or avoid this or that. And a lot of times we adjust it and the reflux goes away. Sometimes that can be a little bit trickier. Sometimes we have to dig a little bit deeper, but and adjust a few more times. But reflux is huge. I've had parents bring their kids in because their hip looks like it's twisted out, and I've had some really cool things with that where I adjust it one time and it's just gone, and everything's just functioning well. Let's see, colic, reflux, not sleeping well at night. I talked about that little girl, and she just started sleeping again. It was amazing, spitting up. I guess that goes a lot with reflux. Sometimes that's a different condition. Sometimes it's the same condition. Not pooping well. That's another huge thing that I deal with, where the baby's really straining to stool and poop in their diaper. And adjusting can be very helpful for that. And I've actually had some really cool experiences lately where I'll put that baby on, so their back is against my chest, and I'll lie back on my table, and I'll get my thumbs up underneath and just check that lower back and give a little adjustment, and it will just clunk, like the most amazing sensation. This body just clunks, and the baby just stops crying. And so I had the baby back, and then turns out the next day, yeah, they just started pooping again. It's really cool. Now, of course, these are blankets, and of course I'm bringing up my best examples that stand out in my mind, because yes, it works for a lot of babies. That sometimes, like I said, I have to dig a little deeper, and we have to work a little bit harder, and we have to adjust some babies a little bit more. It just depends on how severe the injury is, just like an adult. And so every baby is different, and every situation is different. That's why every baby has different symptoms. And so two babies could have a very similar injury but manifest the symptoms in completely different ways. Let's see, those things, scoliosis for older kids, parents are worried that their kids might have scoliosis. And so we can take an x-ray and verify if that's the case. Most scolioses are they're neurogenic in origin, which means the nervous system is actually causing the muscles get tight down low on one side and get tight up high on the other side. And it pulls them into this S-shaped curve, or just even a C-shaped curve from the side. And so it's very important to get those things checked as well. Because if we can start adjusting that soon enough, my belief is we can take stress out of the spine, and who knows, maybe we can prevent a much worse situation where they have to put a Harrington rod or something like that in. If you do have questions on scoliosis, if that's something you'd like me to actually do a full podcast on, I can. There are techniques that are very specific to scoliosis that I could actually have guests on as well. So maybe I'll plan on doing that. But scoliosis. I'm sorry, I should have notes in front of me, but I don't. I'm using the same computer that I made the notes on. I should have just printed something off. Now, one of the other stories that come to mind that I wanted to talk about is this is probably 2.5 years ago. This baby came in, and they were from Middle Eastern origin. They came down from, they were driving about a half an hour. I think they were coming from South Jordan. And it was really interesting because literally they just showed up out of nowhere. And they came in my office and they said, this is the situation. We have a 6-week-old baby, and this baby no longer is pooping. And the situation, what we've had to do over the last few weeks, because the baby came out the first 2 weeks, the baby was pooping. And started just tapering off really quickly and just completely stopped having bowel movements at all. And so what they decided they had to do was they went and, of course, they had a biopsy done to make sure that everything was healthy, and it actually turned out that it wasn't. There were no nerves going to the lower portion of the intestine where all the food gets pushed through, and so it can get expelled out of the body. And so something was stimulating that mechanically, or something. That's what they figured the first couple of weeks, and then after a while it just stopped. And so they had some genetic testing done, and sure enough, this baby ended up having a genetic condition that prevented it from, growing the nerves down there. So the lower GI tract just was not functional. The tissue was healthy, but it wasn't able to function in the way that was appreciable to get food pushing through, because you need nerves to function in the body. That's kind of the whole premise of chiropractic anyway. And so they brought this baby down to me, and I don't know exactly what brought them to me. But they said, here's our situation, can you help? And I said, it doesn't really sound like I can help you, because if the body doesn't have nerves, then it can't function. So I didn't give them any more hope than anybody else did. What they ended up, what the doctors told them is that to save this baby, we're going to have to resect a whole section of bowel. And so they're going to have to cut out a whole section of the lower intestine. That was the medical solution that they were offered. And they said, well, can we try? And I said, absolutely. And this is what I tell a lot of parents that come in here that I don't know what's going to happen. I know that the body is capable of remarkable things. And I said, this could do everything. It could be the miracle that we're looking for. It could do absolutely nothing, which I kind of think that's what's going to happen. Or it could do something in between. So we're just going to have to find out. And so what I did is I said, will you please, if we're going to do this, then we have to do this over a certain period of time, and you have to give me a certain number of visits. So what I'm going to ask you to do is I'd like you to bring your baby in 3 times a week for 4 weeks. So we're going to do 12 visits over the course of the next 4 weeks, and we're just going to see what we see. There are no promises. There's no expectation. It's just whatever happens, happens. And so I adjusted that baby on the first day. And then they were very consistent in bringing that baby in. And so we did 3 times a week. Now, in the end of the second week, because I'm always curious, the symptom really is none of my business. Honestly, when it comes down to it, the only thing that's any of my business is whether that baby has injuries in the spine and I need to adjust them out. Because I don't control any symptoms. I don't control colic. I don't control bowel movements. I don't control scoliosis. Those are all symptoms of whatever the body is trying to adapt to because of stress, and whether that comes from the spine or not. And so in this situation, it's hard not to ask. So, all right, how are things going? I want to see if the body's making any changes, positive or negative or anything. And so at the end of the second week, she said, you know what, it's been really weird, but because to get the baby to actually have a bowel movement, they would have to basically do an enema. And so she was washing 3 days a week. 3 times a day. 3 times a day she was doing these procedures to get the baby's intestines cleared out. And so nothing became toxic. And so she said, it's been really weird, but the last few days I've only had to do 1 or 2 washes a day to get everything out. And it almost seems like the baby's starting to poop. At the end of the 3rd week, she said, I'm really only doing 1 a day. And everything seems like it's doing really weird. And the kicker on this is by the end of the 4th week, she said, yeah, the baby's just pooping on his own. And I was like, okay, well, I had no expectation that anything like that was going to happen. And so it was really, really a cool thing to see that, to have a genetic condition and through biopsy verified that there were no nerves going to those lower intestines. And then to see a recovery like that. Now, as far as follow-up goes, they disappeared. I have no idea what happened to them. They may have actually gone back to the Middle East. And I haven't heard anything from them since. And that happens a lot. You know, we'll get some sort of awesome result, and it's like, all right, let's just keep following up and making sure that everything, but people just disappear, and that's totally, it's totally up to them. And so I don't know, but I do know by the end of the 4th week that baby was functioning pretty normally. Hopefully he's still getting adjusted somewhere, but it's not in my office anymore. And so that's a really, really cool story that I can reflect on. Now, as with pediatrics, people want to know what treatment frequency we're looking at. Now, pediatrics really technically is anything from birth through 18 years old. And so as far as treatment frequency goes, it's going to vary wildly. Like I just told that story, when I do tell patient or parents what we're expecting, depending on exactly what's going on and how severe the birth trauma was and all that. Actually, as an aside, I'm going to go back to that study really quickly. What they found, what the researchers found, yes, they found all these injuries in all these babies in all these different areas of the spine. What they found was the largest variable that contributed to risk of injury in the babies was length of labor. Any hour greater than 6 hours of labor increased the risk of injury to the baby. And so this goes back to pregnancy a little bit, and I apologize for this aside, but this goes back to pregnancy where if you're getting adjusted through your pregnancy, research indicates that the length of labor is shortened by about 1/3, which if we're talking about an 18-hour labor, that's pretty important. That's really important. If we're talking about a 12-hour labor, that's really important. My wife's labors were really amazingly short, 4 hours, 2.5 hours, and then 5 hours. And I credit a lot of that to her getting adjusted throughout her pregnancy. She just everything just happened the way it was supposed to. Her 5-hour labor actually was because she had so much fluid in her that she actually had to push the baby down into position so that he could actually engage so that he could be born when she did go into labor a week and a half after her due date. And so that's that aside. But if we're taking care of stuff during pregnancy, then that actually does decrease the risk of injury to the baby, which is really nice how that wraps together. So as far as treatment frequency goes for kids, it depends. I'll tell people this is the worst case scenario, 3 times a week for 4 weeks. And this is for any baby up to about 6 years old. Generally, I expect things to get better much faster than that. 1st or 2nd week, we expect results with the adjustments, and we're hoping to see some change in the symptoms. But again, I have no control over the symptoms. That's all up to the baby's body and how stressed out they are. Between 6, it's not even a between thing. It'll range depending on what we feel like is severity of the injury, severity of any symptoms people are bringing their kids in for. If they're having a lot of pain, headaches, migraines, that kind of stuff, then it's just going to be variable depending on what's going on. How fast they're growing, how big they are, what kind of other injuries they've sustained. So it's going to be really super variable. The closer they get to 18, then the closer it's going to look like an adult care plan. And so treatment frequency is going to vary fairly wildly. But when we're dealing with infants, that's what most people have the most concern about, bringing their infants in. Then it's just going to be probably a week or 2, but maybe up to 4, depending on exactly how severe everything is. Now, the third story that I want to talk about, this was not very long ago. This is like a month and a half ago. I guess it's probably more than that now. Time flies. It's 2021. It's not 2020 anymore, so we're glad that time's flying a little bit. But I had this gal bring this baby girl in who was 8 months. And this girl was crying every single breath that she took in my office. The exhale was a scream. We're not talking just a loud cry. She was screaming every single breath that she came in. Now, maybe a little bit of an exaggeration there, but that's really what it seemed like. She did not take very many breaths without screaming. She was totally uncomfortable. She came in, I was adjusting patients. And the layout of my office, basically, I can look, coming out of my adjusting room, I can look down the hall towards the front desk, and I've got a kids' room in there. And the kids' room, that's where she was doing her paperwork. And I heard this crying and screaming, and I was like, great, we're going to see a baby girl, or a baby. And, but I didn't know any of the situation yet. And I was seeing somebody else. I had another new patient, so I was in and out. And finally, I looked up, and this gal was really struggling with her paperwork because she was trying to get this baby girl to stop screaming. I know how it is to have a crying baby, and you're just like, I'm sorry, I really don't want this to affect everybody else. I want to make sure that everyone else around me is comfortable. And so she was so sweet and so sincere about everything. And so she's not even getting her paperwork done because this baby girl's screaming so much. And so I got to a point where I was able to go up and just say, hey, how's it going? My name's Dr. Erickson. Let's go back and chat. And so we came back, and immediately she came into the exam room, and I took the baby girl and I was holding her, and Mom just started crying. Like, she just needed a cry after all of that stress had been penned up for so long. She'd been containing it so well, and she was just crying. And so I just let her cry for a minute because she just needed to do that. And I said, all right, tell me what's going on. And so the story basically was, for the past month or month and a half, that baby girl had not slept. She had not given them a break. She had cried every single minute, it seemed like. Of course, she would take little breaks just from sheer exhaustion. That's the only thing that some kids will sleep from, is exhaustion. And so that's the only breaks we ever got, where, maybe at night she'd let us sleep for a couple hours at a time. She said, I don't know what to do. She drove in from out of town. She drove literally 2 hours to get to my office. And so it was a situation where, I don't know, again, she came to see me. I have Pediatrics on my website. I hope that I can help when people come in. I said, all right, this is what we're going to do. I'm going to check her, we're going to adjust her, and I'm going to send you home. And I'm going to have you come back tomorrow. And I said, I know it's a long drive, but I need you to come back. I need to follow up with you, and we need to make sure this little baby girl's getting better. And so I took the baby, and so I was adjusting her. And she was so full of stress. I could just tell top to bottom. Everything was just completely stressed out. Everything gets bound up. The muscles get really super tight. And I could barely even get in to adjust most things because she was guarding so much. She was just screaming. And so I went through and I adjusted that upper back, and I adjusted the lower back, and I took her and I adjusted her hips, checked her hips on each side, and I adjusted her neck. Now, there's also a technique that I can do to release the bowel. Sometimes there's a little valve in there called the ileocecal valve, and sometimes we can massage that just right, and it'll release and just let everything go through. And so I did this technique on her as well. And as soon as I did that technique on her, I adjusted everything first, and I did that technique on her. And as soon as I did that, I was looking down at her, holding her in my arm, on my left arm here, how I do the technique, and she fell asleep. Her head just rocked back, and she just fell asleep. And that's typical, actually, of that adjustment when babies have been screaming. And so I said, okay, here you go. Take the baby, take her home. Let's see how you're doing. And I actually followed up with her later in the day. I was calling her. I had to leave messages for her. But she did come back the next day, and she came in, and I said, okay, tell me what happened. And she started crying again. But I could tell it was good crying because the baby was right there, and she was not screaming. And so she cried the second day in my office, but this time for a much different reason. She said, this is the first night that we've been able to sleep. This is the first night she slept through the night. Probably in a year, not a year, because she hadn't been alive that long. This is the first night the first time that she's slept in forever. And she slept through the night. And so Mom was just crying. And so, when I think of stories like that, sure, it contrasts with stories that we have a much harder time getting stuff done, and there's so much frustration with the parent and with me. I have an ego with this. I want kids to get better. Of course, I don't have control over symptoms. I keep saying that, and I can't own that portion of it. I also can't own the miracle that occurs when the baby comes in and she slept through the night for the first time. That's not me. That's that baby. That's that baby being able to express his or her true potential because there's less stress in the system. The only thing I can take credit for is pop, 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 pop. If I'm good at my technique, if I'm able to get to the areas of stress and if the body's having symptoms because of that stress, then the body takes over. And that's where I don't get to take any credit. I don't get to take credit for migraines going away. I don't get to take credit for back pain going away. All I get to take credit for is reducing the stress in the spine through specific adjustments. And that's in adults and it's in kids. And so it's really important to me that I have to remind myself again and again, I don't get to own symptoms and I don't get to own results because results always come from the kids. The reason that I have good reviews is because I work really hard on my technique. And I take what I do very seriously, and I do everything I do with intention. Now, intention is really important with chiropractic because we need to have a goal in mind. And my goal has to be that the body is going to express itself in the very best and most normal way possible. We're put together in a very specific way, and we're designed to operate in a very specific way. And if there's no stress in the system, then it's going to operate that way. The more stress we load into the system, spinal trauma is one form of very severe stress, then the body's going to express, if we do have stress in the system, it's not going to express itself the way that it's designed to, and it's going to start having more and more symptoms. If we reduce the stress, then the symptoms tend to go away on their own, and then the body will express itself more normally, and it becomes more adaptable. That's been a big word in my office this week. I've talked to several people about adaptability. And so, pediatrics is really important to me that kids get checked. Because if they're walking through life with stress, then they end up with more problems. Now, I have in the past, I've talked very heavily about things like ADHD and anxiety and that kind of stuff. I was reprimanded a little bit by the licensing board because I started talking about that too much, because those things are not in my scope of practice. And that goes right back to what I was talking about before. If I believe those things are symptoms of stress inside the spine and inside the nervous system through spinal trauma, well, then I can adjust the spine and get rid of that stress as much as possible. But again, I don't own the symptoms. If anxiety and ADHD are symptoms, I can't own those things, and I can't actually advertise that I can help with those things. Even though I've seen remarkable things happen with the human body. I've seen remarkable things happen with the human body. I've worked on kids with autism and had their parents tell me, oh my gosh, the outbursts in public places are so much better. Haven't had those issues. Or he doesn't run away anymore when he gets out of the car. Or, lots of different stuff. Being able to read much better. And so, yes, I've absolutely seen many things happen with that. But all I can own, all I can really talk about is the spine. Because the spine is tied into the nervous system. The spine is our most sensitive sensory organ. If you think about it in those terms, it's also a foundational, it's the blocks. That's what we think of the spine most of the time. It's a bunch of blocks that the rest of the body is built around. It's the foundation structurally of the body. But it's also our most important sensory organ. When we lose that sense, then the body has a much harder time regulating itself. And so, and those senses, or we get a bunch of negative senses coming up, those things come from injuries. And so the more stress we have there, the more stress we have here and up in the brain, and so it takes a much bigger toll on the stress levels of the body. So I don't want to talk specifically about things like ADHD and anxiety and OCD and ODD and all those things. I've seen amazing, remarkable things happen with those symptoms, but those are not conditions that I treat in my office. And so, if you have questions about that stuff, feel free to text or call me. I think that I might be done talking about this for today. I can't think of anything else, and I need to get home. This is early on a Friday morning. I need to go home and support my family. So that's the end of Pediatrics 1. I might do another one. We'll see if anybody even wants to hear about this stuff. But thank you for joining me on today's podcast. Dr. Spencer Erickson, Timpview Chiropractic, located here in Orem. If you want to get in touch with us, the front desk, the number is 801-762-6940. You can contact me through email, drspencererickson@gmail.com, and the front desk at timpviewreception@gmail.com. If you have questions about adults or kids, pregnancy, whatever, let me know. I'm happy to field questions, and I love what I do. So I'm grateful to be able to sit down and chat with you today. I hope you have a great and marvelous day, and we will talk to you soon.